The parking is kind of bad, so we're gonna wait another couple minutes to get started, okay? Is that all right? Thank you so much.
It was fun. We had a good time. Good to see you.
It's okay. couple of minutes slow, so it's about 5 after.
Okay, we're going to get started. This is, my name is Don Bennett. I am the Executive Director of African American Leadership Forum. I'm going to have you all just take your seats so they can see my sign.
Yes, ma'am.
What we're going to do is introduce you all first to who is in front of you. You know, it's me, Don, Executive Director of African American Leadership Forum. I've been doing a lot of activism here in Kent because we don't have very much. We have some. And you have to get to those who are not listened to often in Kent. It's set up as a circle because this is not them presenting to you. This is a back and forth conversation. You are going to have Matthew, raise your hand, Matthew here, Matthew and Keisha back there. You see, when you all ask questions, they are going to have the mic for you because this can be a really long conversation because we don't have a lot of services going on for those who are, I'm not even going to say homeless because I've seen them. All of the people who are in the woods here in Kent, we have to serve them. And we have the people in front of us that can tell us the how and can tell us the why they have not been. So this is really close to my heart. I've always worked with young people. When I became a social worker long ago, I had a caseload of homeless teens for the Obras Center. Everybody know about the Obras Center? Y'all know it happens all the time. People are like, who my kids manager? Okay, so I was at the Orwall Center for a long time. I had a caseload of all black and brown young people. White kids were able to get placed. My caseload never got placed. So we got a eclectic group of folks that can speak to some of that. Just leaving some of our black and brown kids out on the streets. This is in Seattle, wasn't it? But I see here we just leave people. Just doesn't matter. So we're going to have that conversation today. And so what I'm going to do now, Keisha's back there taking pictures of my coat. You guys like my coat? I had to do a whole photo op back there with this coat. It's from an African designer. I do a lot of African designers. I do also wear polo. Anyway, Lakeisha and Matthew are going to get the microphone around to you all when you're ready to talk and ask a question. Please don't be shy. Do you want them, raise your hands if you want them not to be shy. Don't be shy. These are the people who would, and you can write if you're shy. You can also write and submit a question because who has a card?
There's 3 cards. There's 3 index cards, so if anybody wants to write down a question, they can do that.
And it'll be read out loud. I'm going to start with some questions. Before we start, we're going to have them introduce themselves. Talk about your name, your district, and who you serve and what you do. Thank you. Start. Name, district.
Good afternoon, everyone. My name is Edwin Obras, state representative in the 33rd Legislative District. 33rd Legislative District serves is Kent, part of Kent, downtown and west to Des Moines, SeaTac, Marion, and Wilmington. And thank you all for being here. Thank you, Donna and Keisha, for putting this together. Look forward to the conversation. This is we have limited time, but we could probably be here for a really long time talking about a lot of things that we want to solve.
Good afternoon, I'm Tina Orwall. I have the honor of representing the 33rd Legislative District, same area as Edwin, it's my seatmate. I'm a social worker and mental health professional. I do a lot of work around 988 and behavioral health. So I'm just really excited about this forum and the conversations we're going to have today. So thank you.
Yes, my name is John Boyd, Kent City Council. I'd like to say thanks to African American leadership and Kent Lutheran for allowing us this space to discuss this very important problem that we're facing. This is a problem that which has been talked about long time ago, but glad we're talking about it now. Thank you. But also, I'm with 33rd to PCF.
Good afternoon. My name is Debra Entenman, and I am a representative from the 47th Legislative District, so I'm up the hill. So it's East Hill, cities of Covington, and parts of Auburn that are my district, but people don't care about that. You represent Kent, you represent all of Kent, and that's how I like to move forward as we continue to try to do this work to solve this really difficult problem. Been elected since 2018, and I'm hopeful that I will continue to be able to do this work on behalf of the folks here.
I'm Pastor Tormod Svensson. I serve here at Kent Lutheran, and I've been here about 2.5 years now. And I often meet, the folks who we're trying to serve in such a manner. And you hear the stories, and we'll talk more about that, I'm sure. But this is something that my faith brings me to, because it's about justice. It's about caring for the least of these. Thank you.
Thank you all for the introductions. Please clap it up for the. Welcome in, come on in. I also want to say that this is also brought to you by Lakeisha Smith back there.
Kent Community Coalition for Change.
Thank you so much, Lakeisha and Michelle, guide us. Huh? Also, this is also brought, Kara, can you please raise your hand, Kara, and the rest of the Indivisible Kent folks back in the back. Indivisible Kent has jumped on board to keep this conversation going and help to get some new conversations going in Kent. Thank you to Pastor's Church, Kent Lutheran. He has involved himself in this conversation and all of the things that we're doing. We came to him, Lakeisha and I came to him and Michelle, and let them know we'd like to do some things out of the church, and so they partnered. African American Leadership Forum, Kent Lutheran Church, KCCC, we're also partnered with, who are we partnered with? The church, the other church. New Beginnings, Pastor Braxton. And so, New Beginnings and Kent Lutheran, both of them have been serving those that have the least. And they give them food, and there's nothing else to tell them. Nothing. Just give them food, and then they have to go outside the ordinances, I guess, which makes no sense to me. I've been here for 28 years, and I don't understand why we cannot figure this out. So we're going to start the conversation to figure it out. And thank you, Pastor. We're going to start with you. And we're going to start and talk about something that's kind of, people are like, you're going to talk about that? Yes, I am. I'm going to talk about why we cannot have tiny houses. We have a pastor that wants to do it. So I think that's pretty much the game. We just need some land. We just need to be able to build. So I'm going to have you talk about the problems that you're running into. Have you all just make a comment about tiny houses and then open it up. Y'all get ready. Debra, this is from your question. Okay.
Yeah, so I've only been here 2.5 years, but I also learned that there was a proposal to bring in some tiny houses as part of the solution, right? And it was shut down. And I was very curious about that. And what I've learned since is that Kent is very complicated. Okay? What I've learned is that there are a variety of interest groups in Kent. Okay, we have the local business community, for sure, and we have some larger corporations, and we have, the Kent government, and all this. And what I often find is the least of these, those two do not have much. In other words, no place to live and so forth. Their voices are silenced. Okay, their voices are silenced. But what I've learned also, when I bring their voices to some of their local politicians and government, it's not heard. It's not heard. They might hear what I'm saying, but it's not listened to. And I just want to share a few things that I've learned from the folks we serve here. We serve community meals twice a week, and it's often 100 to 150 people, okay? And after the library closes at night, there are no places to go to the restroom. There are no public restrooms. We're human beings. We all function that way, right? We need to go, and yeah, you are going to have human waste in places where you don't want human waste. It's like, you need to have a public restroom. And what about showers, right? How are you expected to get a job if you don't look clean? What about laundry facilities? What about these basic needs? And there's been very, very difficult to have these conversations before, because my impression is we want the problem to go away. Well, the problem is people. The problem is not a problem. We're talking about folks who are just like you and me, who are in an unfortunate situation. So we have to do better.
Well, I don't disagree with anything that's been said. As a member of the legislature now, and a previously staff person for the member of Congress that represents this community, what we have heard from members of the City Council, whether past or present, is that if we were to provide services to the homeless, they will be around the businesses, and that will drive people away from coming to the businesses. If we provide services to the homeless, that will encourage them to have their friends also come to Kent, and so that we'll have more homeless people, because it's a place where they'll learn that we are providing services. And then, I remember when I first moved here from Seattle, I moved here 30 years ago because my daughter's 39 and she had her 9th birthday in our new house. And we were told that most of the people who are homeless really weren't from Kent, they were from Seattle. And so they really just needed to go back to Seattle. And they were being encouraged through bus tokens and bus tickets, because this was before we have the light rail, to go to Seattle to have their needs met. But what we have learned over time is that wherever there are people who are homeless. As our economy grows and as our community grows, we have more people who are not able to afford to have their basic needs met. Are we responsible for those people? I believe that we are. So I want to make sure that people understand. I believe we're going to be homeless. There are a number of things that we have done within systems. Federally, our housing authorities are a little different. Housing authorities, so I grew up in Seattle when I was young. Even though my mother went to work every day as a teacher in Seattle Public Schools, I grew up in low-income housing. I grew up in low-income housing because my mother and my grandmother, my brother and sister and I were living off of one income. And that was the income of my mother, who was a teacher. And teachers make money now. Of course, it's not enough, but teachers made even less money then, enough to qualify for low-income housing and reduced price lunch. We didn't qualify for free lunch, but we qualified for reduced price lunch. In our community that we lived in, that was called Greater Vista, we also had people who they called, I want to make sure I get the name right, people who were so poor they actually had nothing. Like, my mother went to work every day, but there were people who were so poor they had nothing. So they actually had social workers who would come in and help those people get to a place where they were ready to try to find part-time work. Many of them went to work for the housing authority, doing facilities and lawn care and cleaning empty apartments and painting those apartments to get them ready for the next families as families transition. Because families didn't stay in the Vista or Holly Park or White Center forever. Many of those families, once they got those family wage jobs, because they came up here to work for Boeing and to work in the shipyards, they got those family wage jobs, they were able to save up enough money, and then they were able to move. So people transition through low-income housing. That is not what is happening now. And that has to do with housing, federal housing policy. we talk about generational poverty, but we perpetuate generational poverty. And so people need to understand federal housing policy, to understand that we don't allow people to save enough money so that they can buy a home, because if they have money in their savings, we want to raise their rent. And so if they have money, or if they have an additional job, we penalize them by saying they are committing fraud. Even though they're telling you that they're working, they have a plan, and people will then be able to transition. We no longer support that plan of transition in our federal housing policy. A lot of people don't know that either. And then we have decided, which is the thing that I'm not really understanding a lot about, but there's also a federal housing policy that said some people would get a housing voucher to live in an apartment and outside of the low-income housing project. And some people would get a voucher to live in what we would call the market, which means in a typical apartment complex. But then we changed our federal housing policy to say people who live in the federal housing projects get a voucher. So that have the vouchers. Because you didn't need, if you already qualified to live in the federal housing project, you didn't need why would you need a voucher? So then all of a sudden, these people who didn't get a voucher before were now getting vouchers. So we have the vouchers that went into the private market. And then we have housing policies around who gets the dollar, how much dollar they get. And we decided that we were going to, instead of having 1 and 2 quote-unquote low-income families living in an apartment complex, we created these low-income apartment complexes where a landlord could just say, well, I'll just have all Section 8 in my apartment complex, and I will get paid partially by the federal government, and then whatever the folks can afford to pay me, they will pay me as well, but I will have guaranteed income. That wasn't something we needed to create because we had low-income housing already.
And sorry to cut you off. And then when did we hop into certain cities getting tiny houses and then we
So the whole tiny house scheme,
Okay.
I'm going to call it a scheme. First of all, I don't think we asked any homeless people if they wanted to live in a tiny house. Because most of the tiny houses that we see in the United States are different than the tiny houses that they make in other places.
Okay.
Our tiny houses make people have communal showers and communal heating.
Okay.
In other people's tiny houses, it's a very small house, 1 bedroom, but you have a kitchen and you have a bathroom. And so I believe having a kitchen and a bathroom is having dignity. And so people who are living in the tiny houses that we create, I believe we remove their dignity. Now, some people will say, well, you've never been homeless, so wouldn't you rather be in a tiny house than live? People want autonomy.
I'm going to stop there with you. We're going to slow down, but this is a good conversation.
Yes, it is a good conversation back on the tiny homes. 2.5 years ago when I came on the council is when we were discussing the tiny homes. And the debate was that they didn't want to have homes where people could go in there and do their drugs. Yeah.
Okay.
You know, they didn't want to support their habit. And mind you now, I've been to several different tiny homes throughout the South King County, and they do have some tiny homes that they're not being supervised. And some of the stuff is going on.
Okay.
So for us to get the tiny homes here in Kent, we would have to really be structured. We would have to have, compliance. We would have to have people, put on the path back to stabilization. The tiny homes is just transitional. We don't want this to be, for the rest of their time here in Kent. But tiny homes, I do believe we do need to have. Like I said, we need to have structures. years ago, I was homeless. It was for like 4 days, but it was scary too. It was scary. It was in Los Angeles, California too. It was scary. I mean, we had to check into a hotel that wasn't too up to date. You know, people from each side of the room were fighting, doing drugs, and what have you. And that was the scariest time of my life, of those 3 days. So I know what these people are going through out here doing this 24/7, 5, 10, 20, 30 years. I work with this, I'm on board of this organization called THS, Therapeutic Health Services. And right now, matter of fact, just yesterday, we put into operation a mobile dosing unit van that actually goes out to these tiny homes to treat these people. I got to quit saying these people. To treat the unhoused people for drug addiction and alcoholism. And it's a van that goes to, like I said, to the majority of tiny homes. But I'm talking to the CEO right now, just trying to see if we can get them to come on here. We can't, because right now they're all in the Seattle area. And also, you know, homelessness is a bad place to be. And hopefully that it is how we can deal with this. Because, you know, it's not a crime to be a homeless. But I take that back. In Louisiana, you know, they want to make that a crime. Everybody heard about that?
Yes.
The first time you get cited for homelessness in Louisiana, I think it's $500. The second time is $1,000, and then after that, you go to these prisons, you know, and work for the slave labor and stuff. So we don't want Kent, we don't want the state of Washington to become like that. We don't. And I'm glad we're having this conversation today, and hopefully this conversation will continue. Thank you.
Thank you. You know, I do think we need to come together as a community for solutions, and I think there are a number of things that we can be doing to support people that are unhoused. I know when I worked for the City Seattle Office of Housing, we created about 1,000 units, and it was permit support housing with very intensive services, and it had mental health, substance use, and medical, and that model was highly effective. One of the things, though, for South Kent County is I think our models need to look different. They need to fit what fits our community. There's a safe haven model that I love, which is like almost like a drop-in center on the lower level. They have transitional and permanent support housing, and they're smaller. They're not these large facilities, and they tend to fit better in the community. The tiny homes, I've been part of a conversation. I know Miss Lee of Lehigh actually does some of the tiny homes in Auburn. I think I've been out to the ones in Seattle. I agree they're not ideal, but if you have plans to open buildings and they're a stepping stone, as long as you have the security in place and you have the treatment, they can be a very effective stepping stone. And maybe we can, you know, go bigger. You know, the new manufactured homes that we've all been hearing about in Olympia, maybe they are more affordable. Maybe we could do a better job of having the restrooms and other things available. And so I just hope we put all the solutions on the table and then kind of work through all of them.
Thank you. I don't know what else there is to say, but I come from the human services background, and my day job is in the city of Seattle, and one of the things where the area that I worked in over 10 years ago was homelessness. So we funded programs and agencies that stood up shelter, providing shelter, and a new strategy came about. Dawn, you asked about when the tiny home villages come about 11, 12 years ago. One was in the Rainier Beach area, then Allard, and Inner Bay. And it was really about the political will at the time. What can we do? Just previous to that, the mayor of Seattle, after some violence in an area known as the jungle along I-5, along the slopes of Beacon Hill, folks had a community there. It was a violent community, but it was a place where people could not be seen. when you're unseen, there's a level of protection there. However, there's also going to be other things like violence and drug dealing and things of that nature. They mandated that area be cleaned out, cleared out, and daylighted the issue of homelessness in the city for the first time in a very major way. We saw large amounts of boats and tents and all the belongings concentrate in this Soto area of Seattle. And it really was in front of me. There was no way to get around what was happening to people that we didn't either know exist or didn't want to acknowledge that they existed until you read about something happening in the paper. So it's the tiny home villages, I feel, was a little bit of a response to that and the next strategy. And we come up with different means of getting to the next strategy. What does supportive housing look like, and more shelter, and folks were still kind of where we were 10, 12 years ago when I mentioned these type villages showed up, and probably 20 years ago as well. I worked for the city of Seattle. When I was there in the homelessness division, we had 2 planners for all of that work around homelessness, including food banks and meal programs. Now it's blown up because we've had to create infrastructure where we're not dealing with homelessness at the federal level. Representative Edwin talked about all these things that are happening on the federal level, on requirements. So I think there's just a lot of falling that's occurring with the way that we have to come up with solutions. And currently we're supposed to have developed this organization, a structure, and have a regional approach. And we're hearing now may not be working out with the King County Regional Housing Authority. And so there was a lot of effort, a lot of resources put into the organization. Folks are feeling when next. And so who administers and coordinates? And I think I'm looking at all of you folks because I'm pretty sure you'll all be impacted by what's occurring at our county level when our leaders are leading. So just want to name that, and folks on this panel are here to listen and want to be part of the solution.
Thank you all for your questions. And so I'm going to open up to questions for you all. You first.
Me first.
Matthew has a microphone. This microphone is for these folks. My ask is that you do not ask a big, long, compound question. Don't be asking 3 questions in one. Everyone gets 1 question, and then we'll make our way back around to you. These folks are the ones who give the time here. These are the folks that have to be solutions-minded. This is not going to be the first conversation. Not when we have a whole church that we get to do our work in, and then we have another one down the street. So we'll have these conversations a lot.
No, I'm saying.
One more thing too is if you've already heard your question answered, asking it again is probably not going to get a different answer.
And let us know who the question is for. Is for the whole panel or is for a specific person? Please let us know. I'm gonna shut up now, Keisha. Okay.
Hi, my name is Shalisha. I am with Healing the Hearts Ministry. We're a drug deliverance outreach that goes out into the communities and we serve people that are unhoused. I also am someone who was homeless in Tacoma for 4 years. I experienced living in a tiny home and tents and everything, you know. I understand that there is a housing problem here in Kent, but really I think what needs to be addressed is the drug problem. While I was living in the tiny homes, I didn't address my addiction, and I stayed out there. I was blessed with the opportunity of drug court, and I believe you were at my graduation in July. Yeah. And so, the question is, have you guys, so we are like feet out in the community. When someone calls and they want detox, they want treatment, you know, Jess calls us the runners, we'll drive them. There's no detox here in Kent. There's no really inpatient. No inpatient. Me and my husband, we drove in multiple people from Kent all the way to Tacoma. There's been times there's not a bed in Tacoma, so we take them to Seattle. There's been times where there hasn't been a bed in Seattle, and we drive 2 hours to Skagit detox. So maybe, I guess my question is, have you guys thought about maybe opening a detox here in Kent?
Well, thanks for sharing your story, and it was such an amazing graduation. So congratulations. You know, it's interesting because Kent has the only involuntary detox in the state, and it sits half empty all the time. It's run by Valley Cities just down the street. So half of it has psychiatric beds, and the other half have involuntary detox. And I feel like we need to have a conversation. Why is this resource sitting in our community unused?
Yes.
And
Tacoma folks.
so I think we need, I'm more than happy with whatever group wants to meet. I do have a meeting coming up with Valley Cities. It's very interesting what happened to Valley Cities. They are one of 2 providers in our state that are going to be certified CCBCs, which are certified community behavioral health clinics, which will get intensive infusion of funding. It will be 24/7 intensive services. So here we have a provider who's got this new status. We're sitting on a facility half empty. And let's, you know, maybe we can figure out a pathway in for them. Absolutely.
Yeah, so I knew this question was going to be asked, and I didn't have the answer, so I had to go online to check it out. And there actually are some treatment centers here in Kent. You don't hear about them a lot, but they're here. And we have maybe 2 or 3 inpatient centers. I know it's hard. I'm sorry. But they say on paper and in Google they're here. Now, are they actually functional? I mean, are they there for the funds and grants? But it does say Kent has programs here. It has 3 inpatients and I think maybe 8 total treatment programs.
We'll get your information, we'll start a conversation with the senators and all of us. Okay?
All right, we have a question.
Good morning, good afternoon. So my question is, homelessness is a very broad issue, and what I see here in South King County is a growing elder homeless issue. And so in breaking that down, we sometimes have 1 or 2 things, whether it's rate goes up or a medical issue. And we've seen some of our hospitals exit our elders to day centers with no housing around. And they're not diminished capacity per se, but they're at risk. Is there another organization or is that legislation that's specific for that group? Because an elder in a night shelter is very different than other parts of the population. So I guess that might lead to Senator or Rep. Entenman.
Well, I do think it is a high-risk group, and I appreciate you bringing it up because when you look at the stats of who's becoming homeless, we're seeing increases in the youth and in elders. Those are the 2 groups that really we're seeing an increase in. You know, they used to have these HUD 202s that were low-income housing for seniors, and that was federally funded. And I know there's one here in Kent. And then they stopped funding them. And so we started losing all their housing that was really specific for low-income seniors. So I think we're feeling it just to acknowledge that too. You know, I do think there are some very specialized services for seniors. And there is this geriatric team that goes anywhere in the county that will go to someone and do a full workup. And they also try to help connect them to different types of housing. It may be a little easier if their level of care requires a facility, If it doesn't, that might be trickier, but we might want to involve some of these geriatric specialized teams to come at least do an assessment.
Yeah, I don't have anything to add except for to say, sometimes we have to ask the question, who is benefiting from a senior being homeless? Are we getting more dollars to move them out of the hospital and put them in a nursing home? Are we getting fewer dollars to do that? When we end services for people who are seniors, or we pit services for youth against services for seniors, it causes conflict in our community. There was a group of people who used to work with seniors and in senior housing facilities. And I'm not blaming everything on the federal government. I want people to understand things happen with intention. So it's not just the federal government, but it is also collectively all of us maybe not being aware as we should about what is happening to the elders in our community. And when we see more elderly people coming to our meal programs, are we saying to our city council or our county executives or our representatives, we are seeing more people in our anti-hunger programs. We are concerned that they are also homeless. We used to have South King County Human Services. I'm not saying that they don't exist. I don't know of them meeting anymore. That used to be a thing that I was required to go to as a part of my other job before I became an elected official. South King County Human Services, I don't know what has happened to them. I think it's hard to provide services when we're always chasing the money or the grant and not basing what we need on what we need. And so I think, and that's all I'm going to say about that for now.
I'm with Crime Stoppers Global Solutions, and we've been known our whole lives of raising money to catch criminals and have people tell on who's the bad guy so we can get bad guys off the streets and protect us that way. And I've spent, by the grace of God, 7 months being infiltrating groups like Healing of Hearts Ministries. And I've just gone in and I just started here in Kent, the first one, watching, and I was afraid. I was afraid to touch the people. I was afraid to be near them. But I knew I needed to see what was happening. And I'm new to faith, but I was watching. And I'm watching people like Jesus did with leprosy, touch these people and hug on them and hold them, not discuss them in political meetings, not talk about them as they're not seen. And as Dave Reichert said, Gary Ridgway killed all those women in this community because they were invisible. They wouldn't be noticed. And drawing the people out in Seattle for us to see them was absolutely political for us to see. Unfortunately, it's to raise billions of dollars, and we're not actually solving Shalice and the drug addictions and Chris and people here. We are spending money while murders are being committed. Why my niece died in one of these gammas. Why you all talk about it. We have to do political, we get that. But churches, what I'm watching is God was there before all of our politicians. Jesus Christ came down here and touched these people and walked with the less fortunate. They weren't called homeless. They were just called the downtrodden. We don't have to reinvent the wheel or spend billions of dollars. We have to organize, if we could, like this pastor, with the churches. Not fight amongst the churches, and not have government squish the churches. So my question is going to be, if we organize from the streets up, because that's where these people are at. Today we sat there and touched people. We touched pregnant women who are having babies that are going to have fentanyl in their systems. You can't talk about these things. everything everybody says is right. But sir, you have the ability to do what you do and organize in the city of Kent and in King County, South King County, and organize with groups like this and actually work together. Today, you had 5 people saying, I want to go get help. We can't say that we read about a website that doesn't exist. I promise you, if those places were open, sir, these people would have found it. They would have found it. Because they're not going to drive to Spokane. And they literally have driven to Spokane where there's a bed available. I'm a businessman that knows how to organize and raise funds. But I don't know how to spend it foolishly. And we shouldn't be spending 60 grand on one tiny home because it generates revenue. When I can go buy a $5,000 shelter and call it a tiny home and put it on a piece of land. We can all talk about like it's political. This is death. It's generational thinning out a population of people. And it's drugs that are now toxic. And one hit, after my niece is trafficked, one hit will kill someone. And if you all raised your hands, you would know. Have you had someone die who was on fentanyl and the next drug coming down the line? You can't talk about this like it's politics. So if we could find out how you could help organize and how you could work with these kinds of groups to be the leaders, to organize the churches, to organize the communities. Churches know how to ask for money on Sunday mornings. And they send it to foreign countries to build wells and to build for water. We don't have to go to a foreign country. You can go to the Kent Market right today where the city officials are asking Metro to shut down this outreach because it's an inconvenience to have them draw the people out of the woods in the morning and out of their wet shelters. City officials asked Metro to come there. But unfortunately, Metro, or fortunately, God above, the prayers you did, said, these people aren't blocking anything. These people are saving people. They're cleaning up the bigger area. Your awareness, your church, all these, there's probably 200 churches in Kent. There's one church here today. There's one church. That means we can start right there and not have government involved in that. And also not have government shutting it down when these people do good things on a piece of land that you let people park on for free that could generate revenue, but King County lets them park it free, but you're willing to feed or save lives or bring pregnant women out. I've watched overdose people in that thing. I've never seen a person die before. I watched another person save their lives. And then she put shoes on that girl and socks. And I was overwhelmed and had to leave because I'm like, wow. We don't even talk about saving people. Just let the people do it and get behind them and gather. So how you vet these people so you don't get wasted money and bad people in. But while we're all talking about it, the drug dealer's standing there dealing while we're serving food and they're serving Jesus Christ. The war is going on. And every day people are dying while we talk about it. So Crime Stoppers wants to know, how do we stop crime? We go into where it's at and we stop the crimes before the people create them. Help them transition up. I like you came from literally when it was truly helping homeless people. And that was they put you in Shannon Park housing and you're born into it and then you get up. And then unfortunately I turned my head and said, I'm now successful. I don't have to be part of that chaos. I'm better than that. I'm not, because it's all around us. So how we vet people, how we organize people, I'd like to see, sir, you as a pastor, my question would go, how do you help and how do you come to us and help us help you organize these churches to raise funds that go directly to the people to save a life today, not talk about it tomorrow?
Thank you. I would so love for us to meet and talk more. And, it's a resource issue. It's a huge resource issue. And it's a networking issue, And, I mean, if you say otherwise, I think you're just blowing smoke, seriously. We need our politicians. we need our friends because they do have access to resources and the ability to build some networks and help us to network. So we need all to be part of the conversation. But thank you, because this is the kind of stuff we see all the time. And we're talking about human beings here. We're not talking about, some problem that's far away. These are human beings created in God's image. And I would like to go one step further. I'm building some interfaith connections with the Sikh community and our Jewish friends as well, because this is a humanity issue, and we need to start the networking, and I will be part of it. I'm going to reach out, and I would love for us to talk more. Thanks.
I want to say I just got phone numbers for some of the team talking about, and pastors are individual organizing already, so we want folks to join in what they're saying. And I wanted to say there's not just one church here, there's two. New Beginnings is there too. So when you think about John and I, there's people. Well, there's more churches there than that. And so the churches to come on with us, to organize with us, starts with the two New Beginnings, and then it will open up to whoever else is here can hear them. And then Lakeisha, here you go. It's all you, Lakeisha.
Yeah, Kent United Methodist Church. We've been meeting now for a while, so there is stuff growing and there is stuff brewing, and we will continue. We're not going to stop.
Thank you. Thank you for starting. Go ahead.
I just wanted to revisit the previous question. Can you guys hear me okay?
You have to speak into the mic.
Okay. I think we also often talk about post-care, but we also don't talk about prevention.
Right.
I think we need to ask why are seniors becoming homeless and why are youth also becoming addicted to drugs. I think a lot of people talk about data centers now and the effect of water consumption and usage and electricity on the impact it has on the community. But if we look at Kent, and I think I can say this because I was born in Washington, I was raised in Kent all my life. So I went to elementary school, middle school, and high school here, is that we have a lot of industrial industries here. There's about over 10 aerospace companies here. There's Amazon here. There's Boeing here. And the cost of electricity and water that these companies use are being burdened by the community. We pay that price. And so as housing increases, yes, these seniors, maybe they paid off their homes, but they still have to pay for tax, and they still have to pay for their yearly property tax. And now they're dealing with costs of gas, food, living, and industrial land being here. And so that is causing a lot of seniors to become homeless. And so what are we doing? I know you guys already talked about this and policies like that too. But what are we doing so that the cost of not just data centers, but the cost of the cost of companies building industrial land here isn't being burdened by the community? Because what I've seen is the last 20 years, it already is being burdened by the community, and I've seen no one address it so far, or enough action on it to prevent this from happening.
So what's happening is there are some elected officials in this city who have decided that we need a broader tax base. So they want to encourage businesses to come and move and grow in our communities so that we can have a larger tax base. So if I don't have business, the argument has been made, if there is not business, then we have an increase in our property tax. So we encourage business to come, but then we also do something that I think is perverse. We encourage business to come, and then we give them incentives, which means they don't have to pay as many taxes as they would have had to pay if they had moved someplace else. So we can't, on one hand, say we want to increase our tax base, and then on the other hand, give a business a tax break for moving there. So that's one thing. So when we are in our city council meetings, we need to listen. And what people need to understand about city council is by the time they are having the public meetings, there is public comment, but that is not public discussion. So there's one step before that, and it's on the boards and commissions that we have in our city that are determining these things before they come to the city council. And so asking people to volunteer is something that is helpful for politicians, because we can't possibly go to all the meetings that are occurring. But if 3 of you came together and said, 3 of us are going to go to the planning commission meetings, and 3 of us are going to go to the permit commission meetings, we don't all have to go, but we do need to have representation on those boards and commissions that then report back so that we understand what is happening in our community. For many of us, we get upset and go to a council meeting and get 3 minutes and don't get any of our questions answered, and then we're angry. But that's not how the system is set up. So you need to know when you can ask questions. It's important to read those poster boards and those notices that come out about what is happening in community, about what is being built and what is being sold, and it is also important to ask questions in those public arenas consistently. So for example, even if you know that you go to a city council meeting and you're never going to get an answer to your question, every single council meeting you should be asking that same question. Stand up and say, my name is Debra. What are we doing for youth homelessness in Kent? My name is Debra. I care about youth homelessness in Kent. Having young people come to those meetings and stand up and say, my name is Debra. I'm 16. I live in Kent. I'm concerned. Makes people who are on the councils understand that it's not just that we're there, but we're there and we're watching. And I know that is not easy. I'm not saying it's not. I'm not saying that it is. People work. Most of the people in the legislature have 2 jobs. Most people don't know that. Most of the people in the state legislature work as a legislator, and it's either 60 days or 105 days. And then what we have is interim. So right now we are in interim. And many of the people that have jobs, they work for different cities, they work for different counties, they have their own businesses. So they have 2 jobs. Most people don't know that we have 2 jobs. So we do need your help in attending these boards and commissions where decisions are being made and impacting all of us, and then it gets to the council and they vote on it, but we haven't heard anything about it, so we don't even know if we should be upset. We don't even know what's happening. So it's really important for us to, we have a reciprocal relationship, and we need to both work together to find out what's happening in our communities and talk about tax policy. This thing I know. Right now, we have somebody running to be the King County assessor. And one person is saying we should tax golf courses. I don't know if we should tax golf courses or not, but I never heard that proposal before. So it makes me want to know more about why aren't we taxing golf courses? Another person is saying in the north end of King County, seniors know how to apply for senior discounts for property taxes. But in the south end of King County, seniors can apply for those discounts for property taxes, and they don't do it. Why do the people in the north end know how to apply, but the people in the south end don't? So those are questions we need to ask ourselves. We need to communicate with each other. You can apply for a property tax reduction if you are 65 plus and you live in King County. You call the King County Assessor's Office. If you are 65 and over and you live in King County and you want to reduce your property taxes, call the King County Assessor's Office. Say you are 65 and have them explain to you what are the next steps you need to take to reduce your property taxes. I hear from people all the time saying that they're moving to Utah and Idaho because their property taxes are too high. And the first question I ask them is, did you ask the King County Assessor to reduce your property taxes because you're 65 years old? And most people say, I didn't even know that I could do that. Yes, you can. they do it in the North End, we can do it in the South End. We should do it in the South End.
So,
Thank you.
For everybody to know.
I was just gonna,
One second, for everybody to know, when you raise your hands, Matthew and Keisha are keeping you all in order and giving out the mic.
just really briefly, thank you, Edwin. Always filled with resources. I consider her one of my mentors in legislature. I think what we have to really acknowledge the fact that we're organizing here in this room, we're having these conversations, and we're daylighting many things that we all want to move forward. We have to keep this momentum going. Can be these disparate efforts, but we're here together now, and I want to know what the next one is. This is how you build movement, this is how you build solidarity. When you organize, you win. So I just want to leave that with you all, that this is a room filled with people who care. This is a room filled with people who have lived experience, and the folks who have lived experience can lead and help us find solutions. But as policymakers, we're here to listen and be resources. I'm just going to give the mic to Representative Entenman. She always has Senator Orwall. I'm just really honored to be here because I've served in the legislature only the last 2 sessions. I've worked on human services forever, but this is really an opportunity for me to be in community, hear what is really affecting you all, and please reach out to me and anyone else in this room about how you could run for office, for example. This is where we need to have that movement as well. We need to develop a pipeline of folks who are interested in the same things that I'm interested in. So that pipeline, does it exist? Perhaps. But when we organize, we win.
I just want to confirm something that I made a statement about the program being in here in Kent. Only one program I know that it actually is in Kent is Valley City. The other one, like I said, I saw it on Google. Okay? So I don't want to make it where I've actually been there. I have. The only program, and this is for disclosure too, the only program that I knew at one time had inpatient treatment was a place called CMAR. I used to work for CMAR. Worked there for 4 years, and we had a 21-day inpatient treatment program. And CMAR, that program there now is no longer there. So I just want to make sure that nobody misunderstands me when I'm saying that there are programs here. I just know what I read. And I knew that question was going to be asked, so that's why I did print out.
Thank you for your research.
Okay. All right, thank you.
Whoever has the mic.
We got a question here, and then we'll come over to you.
I don't need a mic, I'm kind of loud.
Well, we just got we're going in order. Yeah.
Sorry, man.
We'll come to you.
Hi, Logan Evans. I'm a teacher in the Auburn School District and candidate actually for state representative. But anyhow, my question, Washington is number 4 in the nation for overdose deaths. We have 3,000 deaths a year over the last 10 years. And the question was, why don't we treat the fentanyl crisis like we do a DUI? If a person is on their 5th DUI and they've smashed another car, we don't give them another car to then drunkenly drive into someone. So why have you guys considered something like a 3-strike, 6 months involuntary rehab model? I know I've heard a lot of organizations who would kind of like the support to actually compel people who don't have control of their lives, who have lost themselves, and who are dying in the streets, harming others, harming themselves, to get that treatment they need to then get off their addiction and then come back into society with all the proper support structures, instead of that kind of model right now where we basically build opium dens and they die or they live with their drug dealer or they go back out into the street, smoke fentanyl with their friend, come back and then proceed to die again. I mean, it's just very, very dark. So I don't know what your guys' thoughts are on the 3 strikes or a 6 months compulsion model just to get people into the treatment they need.
I'm gonna try to answer that, okay? Fentanyl use, drug use, it's a disease. If a sibling of yours, your mother, parent, has the disease, and they keep getting sick and falling down, breaking dishes, throwing metal in the microwave, are you going to find them? Are you going to lock them up? Are you going to tell them to stay in their room until they learn how to use the microwave right? Don't put metals in the microwave anymore. You're saying lock these people up.
Yes, yes.
Rehab, sir. Involuntary rehab.
I'm going to put them in a senior home. I'm going to put somebody to be with them until they're
Okay,
safe.
but I really want this to work, and I know that these are very emotional, and I understand that we all have feelings about this. So I grew up at a time when heroin came into our community, and nobody cared anything about heroin coming into our community. It just was what it was, and people died. Now it seems to be an issue because some of the people who are dying are only using the drug one time. Or some of the people who are dying are middle class white kids who live in the suburbs. That is not fair. So my emotion about this is just as important as your emotion about this. So let us have grace for one another when we have these discussions, so it doesn't become between one group and another, but solving the problem. Can we do that? Yes. Okay. How many times?
Okay, the statement I was trying to make is this is disease. We got to treat it as a disease. With the counseling, the guidance, and everything. Yeah, 1, 2, 3 times. Yeah, okay, they need serious help. But we don't want to lock them up. Like I said, I don't know if you was there earlier, they talked about locking people up in Louisiana. We don't want to get like in Louisiana. We want to show compassion. At the same time, we want to make sure that these people are obeying the rules and the law. So it's a hard situation that we're in. It is, and I'm glad we're here and we're talking about it. But this is something. It's not going to be solved here in this room. It's not going to be solved tomorrow. It's probably going to take years for this problem to be solved. But we can't say let's lock them up because we just sweeping the problem away or locking the problem up in a box, saying okay that problem no longer exists because it's way over there locked up in a box. We don't have to deal with this anymore. That's not how we're going to fix this problem. We're not.
I wanted to respond as well. I've been working a lot on the 98, which is a place to call, someone to respond, and a place to go. And a team of us went down to Arizona, including our exec and a lot of our providers, and we realized we were missing part of a model in our care, which is crisis relief centers. And crisis relief centers are like behavioral health emergency departments. And what's interesting about them is that they take people from police, EMS, walk-ins, kind of the whole gamut of no wrong door, but they can also hold people for assessment. For people who maybe do need involuntary treatment, we actually do have laws to have the ability to involuntarily detain someone for mental health or chemical dependency, but we haven't been doing it effectively. And so right now, the first crisis relief center opened in King County. It's in Kirkland. It's called Connections. I just went to one in Linwood this week that was opened by CMAR, which is going to be just incredible. We had a location in Federal Way. Unfortunately, it kind of did not move forward, and now I think they're looking for another location. There will be 5 in King County. 1 will be for children and youth. I do think that's one part of the solution. I used to work in voluntary psychiatric unit. We did agreed involuntaries for people to go at the time to longer term residential treatment, and it was actually highly effective. And so, I think we need to look at all those models, but I do think the crisis relief center is going to be an important step to have that next step done.
We have Ricky's Law, right?
We do Ricky's Law. Our Representative Lauren Davis, who we serve with, friend had very severe addiction, and they actually worked together to change our ITA laws around behavioral health. I don't think we've done enough training with our designated crisis responders on this law, to be honest. And that's part of why we have an involuntary detox sitting half empty. So these conversations do connect to how we better utilize. I also met last week with the FD Cares, the fire department cares in this area, and we're bringing all the crisis providers together to talk about this system and how it's working and not working in South King. And our FD Cares and our EMS are seeing people repeatedly that are overdosing on fentanyl. And FD Cares is the fire department has a team, and it involves EMS, fire, has a nurse and a social worker, and they go out to calls, and often it is people that have serious substance use, they're in crisis, maybe they have a medical condition, and they will do engagement and case management, and they will try to help them into care. And so they're a great model, but they are missing that link of the crisis relief center. And again, they'll take people out to Kirkland now, but we really need one in our area as well, because it's an incredible resource. They're created by someone with lived experience, which I love. And there's a social worker, psychiatrist, there's people with substance use expertise, and we have THS, which you mentioned, which I think is a great provider. So I think there are things that are being built. It feels like it's not fast enough. And so we're going to have to lean into what's working in the system and all work together on the next steps.
So we have 1, 2, 3, 4 questions and 20 minutes left. So let's try to keep an eye on how long our question is. So one question, not necessarily a whole commentary, and then obviously you guys keep time for your speeches all the time.
I'll save my speech for later. So that man that's running for state office, I don't know what your name is, but I want to sit down with you. So we don't have a homeless problem, we have a drug problem. Fentanyl's 50 cents a pill. 50 times more addictive than heroin, 10 times more deadly. And his niece was being sex trafficked and died on it. Look on our website, those doors in Beacon Hill in the jungle. I was knocking on every one of those doors looking for an 18-year-old whose dad called me from prison crying because his daughter Cheyenne was being sex trafficked on fentanyl. It's 50 cents a pill. So now kids that get to smoke marijuana, I loved it when I was a kid. I loved smoking marijuana. I partied hard, okay? My party days are over. When I was a child, I thought, acted like a child. When I became a man, it came time to put away childish things. And sometimes, the thing is, some kids get hooked on marijuana, and it's expensive now. So then what happens is they can't afford the marijuana. So then they get a 50-cent death sentence. 50 times more addictive than heroin, 10 times more deadly. That's what we're here to talk about. And if you really care about people, we can make all the little statements and political jargon in the world. But if you really care about people, you've got to have a backbone. Every elected official runs putting off the image to every heart that they care about people. But it takes doing the hard thing sometimes. Sometimes not the politically correct thing. You got people coming from other states because half of our ministry team, we've been running 6 regions now. This couple right here took a 17-year-old off the streets named Shay on Hosmer Street, Tacoma, where Spanway and Tacoma are pushing all their addicts. The mom said she's been on the streets for 5 years, since she's 13. Okay, and so these are kids out there that are getting addicted to this 50 cents a pill death sentence. Okay? Sometimes it's going to take doing the hard thing. I didn't mean to act like there was no treatment centers here. There is. A lot of those treatment centers will not accept state health care. And number 2, to go to a treatment center, you have to go through detox first. That's our issue. Valley Cities is amazing. That's one of our partners. And literally, man, so they're right there on Rainier Avenue, right off I-90. They have a detox. Because when you're coming off something that deadly and that evil, you've got to go through a detox process. You need a nurse by your side because that stuff is that addictive. It can kill you, literally. So then they have a 28-day treatment attached to it. We don't take people to detox unless they're going to go to treatment after. And so Valley cities, they can do the same thing right there. Approach correctly, they can put the same one right here. They got one, that'll be so amazing. But it's gonna take doing the hard thing. Other states have made this a felony because it is a weapon of mass destruction. Okay? And so this is China. China is bringing it in. China's bringing it. China's. I just asked that question.
Where is it coming through?
I just asked that question. I just answered the
Which
question.
border is it coming through?
It's coming through the northern border. You have Chinese cartels.
You said it's coming through the northern border.
Yeah.
Okay.
Great. Yes.
That's one answer to questions. Yeah. Okay, the question, the question is, are you willing to call this problem what it is? If you're going to take care of a problem, you need to get to the root of the problem. The root of the problem is fentanyl. That's what it is.
The problem is drugs.
I know. Well, it's fentanyl, 50 times more addictive than heroin. You can talk to her. She was homeless out there. She was out here.
Willing to work to defeat drugs in our community.
Yes, I agree with Representative Entenman. And the problem is fentanyl, the drug. Well, we need to go after the pusher, not the guy on the corner passing them out and selling for 50 cents a pill, but the main man on top. And that's the person that government don't want to go after because this is a $1 billion industry. And they don't care what it does. But those are the ones we need to go after.
Let's hear more questions. Three more questions. You want to and audience in here?
Do you have any questions?
No, I'm another thing.
Okay.
I got them in my head.
We're going to do this again, everybody. I'm glad that we have questions. We're going to do this again.
I'm homeless on the streets, and I'm actually known for an advocate in Auburn and I've been out here for 10 years. They call me JJ. And I gotta be honest, I'm not negating anything that anybody has to say. I'm not trying to be right now. I'm trying to be real right now. We have 8 Fortune 500 companies in this country. We're the richest country. And we have rent at I mean, it's ridiculous. And I've talked with leaders before, and I've listened to everybody say, well, it's for drug problems, it's our housing problem, it's this problem. No. I think half of our homeless problem is because of our drug addiction, and half of our drug addiction is because of our homeless problem. But you know what I do know? I know that since the government, we have been chasing the wrong question, and that is what is right and wrong. And it's not getting us anywhere. It's a moot point, guys. Who cares? Chicken capers? Yeah, who cares? What do we do to inspire her? That's what I want to know. Because I walk out here every day, and I'm not negating living experience. But it's the lived experience. But when the people that are getting the money, that are getting the grants, the government and everybody that's invested in this and has motivated compassion is standing there controlling that narrative. I'm telling you right now, I live out here. I'll walk out here. My son's 27 years old. He asked me, my whole family's betrayed me. My youngest son, he asked me, he said, Mom, if you're a rose growing up in an abandoned asphalt, all roses are on the other side, why would you love them? I told him, I said, son, I know. I can wait for a bird to pick me up and drop me out, but I'm not going to advocate to that route. Let me tell you something, I know what you're saying. But I walk with these people. I've seen them at their worst. I've seen them at their ugliest. I've seen them at their most broken. I had 172 dead friends in 3 years. And that's not all the fentanyl, guys. I've had 11 friends commit suicide. I knew the people that were chopped up in a suitcase. I knew the lady that had a digger dip. We've had a 112% increase in vehicle pedestrian hits. I got shot at, I can't even tell you how many times. Every single day, I'm afraid of being robbed, raped, or harassed by police. And I go, there's a guy that comes in Thursday, and every single time he sees me, he said, because he called me from church, he said, JJ, how's it going on the streets? So like a year ago, I told him, I said, no, I don't know, they keep uprooting us. They did the Big League Winners camp, that was illegal. The law hadn't changed yet. I said, I don't even know what they are. I can't tell you who's in the hospital now. Now, he asked me this a little while ago. You know what? I told him, I said, you know what? You're not going to like my answer. He said, what's the most dangerous thing you're facing on the streets? And I said, I'm going to tell you right now. It's all of you and the police. You are the most dangerous thing that we face every day. He goes, not fentanyl. And I said, no, fentanyl's killing us. That's not the most dangerous thing we face. The thing we face is people. I am a living experience. I'm telling you right now. We've been spinning around on this little thing, doing a checks and balance system that does not check itself. Check, looks good to me. And the truth is, are we done building programs yet? How about let's start building people? You want to build programs, then let's build programs. Or we can go build. How do we inspire people? You know, how many people are aging out of foster care right now? Most of the people I know, the worst thing I ever hear on the street is their stories are all the same, guys. And it's never the worst one. And you know what I consider last weakest? You know how many people are coming and aging out of foster care and coming out on the streets? You know, nobody's ever said, how are you today? Nobody's ever said, I love you. You want to get people off of drugs? Give them a reason. We want to talk about community. We want to talk about responsibility. We want to talk about accountability. They don't even know what that means. Responsibility, they just think they see themselves get tossed everywhere. You want to talk about responsibility and accountability? Hey, let's handle the mayor here. Let's handle the nonsense that happens where they're getting paid. Because we have the first composting facility in Auburn, Washington in this country. And that was done when COVID started. So you want to talk about what these bodies are? Because I don't know. I got a lot of missing friends. So I'm asking you right now, when are we going to be done redesigning the same year? Because I believe there are people that really genuinely want to help. But if we were back in the Stone Age, all we did was build more walls. And one day, I see a stone in your yard that looks like something kind of funny, maybe a hammer. And I see a stone in your yard that looks like maybe a chisel. I see one in your yard that looks like it could be a wheel. And I've had this crazy dream. And I look like a cuckoo bird trying to tell you all about it because I don't know what I'm talking about. So you're all like, well, we're going to take her off the walk. We're going to put her on. She's going to be a water girl. She had too many rocks falling on her head. But I really am trying to tell you something. Is somebody would have to give me a chance. Because obviously, what would motivate you? Well, because obviously, it's for you. It's not for me. I'm willing to lose my life for these people out here. Not because they deserve it, not because of any of that, but because they need it. Because they need it. Like, we have people sitting here, and it doesn't matter where they came from, guys. It doesn't matter how they got there. When they got there and they fell on the ground, how they felt when they got there, that's the real thing. And that set them off to be the least that they could be. But as a society, this is all we go into, the least of the worst things a lot of times. And this is your best behavior. And I'll tell you what, I'm not very impressed. Jesus came, and he said, the church is made to meet the needs of people, not people who need requirements in church. And he said, come and follow me. He didn't say, hey, you need to go do this, you need to go that. In fact, he actually said, if you cast a demon out, and he goes out and finds nowhere to go, comes back and it's empty, he's going to be a 7-1. Give people a reason. Be the hope in Sunday day. You know how to do that? We didn't need somebody to tell them what they have. See somebody.
My question is, we know there's a drug crisis. Why are we handing out needles
and utensils to use drugs. What are we doing? Why are we doing that? It doesn't make sense. You guys know there's a drug problem. People are dying from drugs. Why are you handing out the things they need to do that? And you guys are letting it be okay. Or up here, Kent, for one. You could go in there and buy gay whatever you need. Why are we doing that? We can go to any little community health center. We can get all this stuff. Why are we doing that if there's a drug problem and you guys want to clean the streets up?
So this, from what I understand, there is a policy, and I'm saying this because I am not a social worker. So I know that there is a social worker here. But I ask these same questions about harm reduction. The reason why we have decided as a society to provide clean needles and other what we would call drug paraphernalia to people who are addicted is because statistics say we are creating harm reduction. Now, people might not believe that, but that is why we have decided to do it in this state.
Just giving us free bottles and hammers and utensils for drugs. What is the point in that? Like, what are you preventing? Because we can go to the smoke shop and buy 100 bottles for $3 each and sell them on the streets too. Or give them away to our friends. I mean, it's not that.
You asked the question, and I tried to give you an honest answer based on the job that I have as an elected official. We provide those things so that we have harm reduction. You may disagree with it, but that is why it happens.
Anyone else want to tackle that question? Anyone else?
Hi, my name is Ty. I work from in Seattle, so I'm new to this conversation in Kent, but I hear a lot of similar patterns that we have in Seattle. I work for Downtown Emergency Services Center. We're mental health, behavioral health. We work with homeless folks, vulnerable folks who have substance use issues and severe poverty. One of the things that I want to ask is, I've heard about generational poverty. I've heard discussion about, the homelessness crisis. I've heard discussion about the drug use. What is the generational situation? What is the generational solution for this? Because this has been happening for 39 years, I've heard someone say, for a very long time. So what is the holistic generational solution for this situation? Affordable housing, crisis prevention. And one of the things that I see that I've heard someone said about people aging out of foster care, a lot of my clients have aged out of foster care and they've been on the street since they're 13. They don't come to services until they're 50. They've lived their whole life on the street, and that's what they know, and that's how they've survived. And they come to me, and we can offer them services. But they've had so much trauma, compounded trauma, when they come to services, that it takes years to get out of it. It takes years to get out of homelessness. It takes years to get out of poverty. I was homeless for 3 years. I had family that helped me. I left graduate school with psychosis. It took me 3 years of meditation, with all the supports that a person could possibly imagine. And it took me 3 years to get a job and to get stable. And that's the best case scenario. I've had people, like I said, 13 to 50 years on the street. So I want to know what the generational solution is for this.
Well, thank you for sharing your story, and I'm a huge fan of the Downtown Emergency Service Center. I've worked with them many years. So I actually just joined a group that's done by it's Office of Homeless Youth. They put together a group, and 70% of the group members are youth. Many of them are formerly homeless, currently homeless, and we're starting to work with them on the kind of solutions you're talking about. I would tell you one thing in Kent, and when I started working with Mockingbird, is we have more kids going to foster care than any other part of King County. And so the Mockingbird model that we've been working in is, how do you provide hub homes and supports to kids and to the families that are doing foster care, but we also want to provide those models for the families that are struggling to keep kids with their families. And so a lot of that work's being done. The thing that just strikes me, especially Lauren Davis, we talked about the work she did on Ricky's Law, is she says the opposite of addiction is connection. And how are we connecting our youth and our foster youth and people that are struggling? And I'm hearing beautiful models of the connection you're doing. I know there's a group of us working to try to get a youth center here. Doug Baldwin is starting to meet with us. They did the one in Renton. We'd like to do one here in Kent because we do think our youth need a safe place to go, to connect and feel heard and seen. And so, I think there are opportunities for us all to work together on some of these things. And the other thing is I work a lot on trafficking. And one of the things we funded is we've been trying to get healing centers for children and youth that are trafficked. And we did fund one that we're hoping will open in Seattle. And again, it's going to take time. It's going to need outreach workers. It's going to need behavioral health and all of us working together. But they did find, because we had a facility in Spokane before it closed, and it's almost 100% of the traffic victims are in fentanyl. And so we need to be able to address that.
So, I grew up in Norway, and there are no perfect ways of living in community. But I think until we as a country, as a society, understand that these are communal issues. These are not just individual pocket issues, okay? There is no homelessness in Norway, I can tell you that. Because the values that are set in the Norwegian society is that there are certain things that has to do with human rights and dignity, a place to live, right? And also, if you look at the difference between rich and poor, compared to, I'm not saying the United States is a poor place, but I think if we look at the super, super rich and those who have nothing, the gap is too big. The gap is too big. There is virtually no middle class left, okay? And when we talk about taxation, there's been that conversation already here, getting started, income taxes and so forth. But what does it mean to be part of the society and the community? Everyone pulls together, and that includes especially those with resources. Because it is a huge resource issue. We're trying some mandated approaches, and we're trying to move on from that. But it takes resources, and we have to understand. And again, it's grounded in who are we? What's the value of a human being? What's the value of a human being? And are the Jeff Bezos of the world more worth than the person who has a place to live? And I will say, we're all equal. So what does it mean? Why do some people have it all and some are struggling even to get by? Thanks.
We're going to end on that. Like we all have been saying, this is not the last conversation. This is just the first conversation, and it needed to be had. I want to thank everybody for your passionate questions, and everything that you all said was very important. It's not gonna just fall down. This church is ready to do the work. And so if you could, hopefully you all signed up in the back to do some work. We also have a team, I think I lead the team, Karen, do I lead the team? Going to, I do, to go into city council?
Yep.
Okay. Indivisible Kent has started going to city council meetings. We were told not just to go to the city council meeting, to go to the meeting of the whole. Meeting of the whole. Excuse me, Indivisible Kent.
And then we just heard we need to go before
for that. This is for the committee. Thank you.
Oh, okay, so we have a start, Representative. We have a beginning, and Indivisible Kent, the ladies in the back, started it with the pastor here, also with Michelle. So we keep starting all kind of noise, because noise has not been started here, so we decided to just start it. So we're gonna start going to city council meetings. We also have to engage with our King County council member who represents us as who? Hopefully you all have a relationship, because we will bring her also. But I want you all to know that these folks, these elected officials and pastor, knew that the conversation was going to get deep here, and they came anyway. They came anyway because they know that the work has been done. Not only did they come, they have experienced some of the stuff that you all have experienced. Some of the death, some of the homelessness. This is why we do this. And so, we're going to keep going. And so the next one is going to be with a conversation with pastor, and whatever committee members join in with what we're doing here. We'll do this again. I'm sure they'll come back. Raise your hands, they'll come back. Yeah! And so right now I'm going to end this because we do have to put it on a time limit. The church has to get to it. Oh, yeah.
I'm glad we had this dialogue. You know, this is not the beginning and it's not the end. We gotta keep coming back. Bring some of your younger kids, your brothers, your uncles. Bring everybody that you can here. Like I said, I'm glad we're having this dialogue. You know, you can talk to me, city council. I can go back to the council. You can talk to our reps, our state reps and our senators, and they can make policy. But we got to have a dialogue. We got to have conversation. And that's what we're doing today. I'm so glad you guys came today. Thank you very much.
Wrap it up, and we are at our end. This is facts. Please, this is facts. We're going to take this next home and get this next. We are